Welcome everybody. I want to dive into what we would call our science when we're talking about immunity. You hear that a lot when it comes to the current COVID-19 epidemic or pandemic, that they want to know the science. When it comes to our science, it's about being whole, being healthy, building an immune system, releasing the immune system, maximizing the immune system. That's our version of health. And so I really believe, since the beginning of this and still do, that it's going to be up to us to teach the world about true wellness, true immunity, what you could really do about these issues now and when we face them again in the future, as we go to try to minimize the use of drugs and dealing with this now and in the future. It'll be programs like this. Today we're going to talk about, first of all, why do old people die? Why is that the case, that we're finding that it's the people over 65 that are the vast majority of the deaths? We're going to learn why that's important for everybody to know, as well as get into this month what we really want to focus on to pull the country out of the challenge of May and get them back on track with knowing how to build a healthy immune system, how to test for a healthy immune system. Also because it's believed right now that the future is knowing antibodies, knowing where people's antibodies levels are at. So we're going to talk about testing those as well. So first of all, when we're talking about immunity, we're talking about immune competency. So even before COVID-19, we actually needed our immune systems, believe it or not. We were always up against pathogens. We always needed to create antibodies. We always wanted to come out and make sure that we weren't having our immune system attacking our own body or creating an autoimmune situation. There's cancer killing, all the time. We're making cancer cells, but our immune system kills the cancer, and just being on defense at all times. Our immune system, in conjunction with the nervous system, is what allows us to survive in any environment. So competence factors, when we talk about these, what we would call comorbidities, they talk about smoking, they talk about having heart disease, having blood pressure problems. These are these comorbidities we've heard about as to why some younger people die, why a lot of older people die. But really, when you talk about immune competence, there are these hidden comorbidities that have a lot more to do with us as wellness practitioners. So you've got the two super systems. There's some great research on the two super systems, the nervous system and the immune system, and that their interaction is what keeps us alive at all times and in all environments. So if there's interference in the nervous system, we know we've got a comorbidity. If you have inflammation in the body that's going on a regular basis, that's not being managed well, that's a comorbidity. If you've got certain nutrient deficiencies, that is a clear comorbidity, and we'll talk about the science behind that in a second. And just body composition. When you have too much body fat, your body's less able to absorb these key nutrients. Obviously, it's another comorbidity, makes you more susceptible to infection and dying from the infection. So why older people die? So basically, all of us have immune features that we're managing at all times, and based on where our immune systems are at in terms of competency will depend on whether or not we're going to get infected by a variety of things floating out there, including COVID-19, or we're going to not get infected, and if we do, how we'll do, whether we get over it quickly, like healthy people's immune systems can do, or whether somebody would really struggle or even die. It's going to have a lot to do with where you're at. I've seen a lot of people over 100 and in their 90s, putting up signs, I survived COVID-19, and most of the time when I'm looking at them, they look like pretty healthy, fit, older people. So when they looked into people that are prone to infection from viruses, trouble fighting viruses, or even dying from them, and the aged, what they found is that over time, we have less nutrients in the system. So your antioxidants, A, C, and E, vitamin D, B2, B6, B12, these, iron, selenium, zinc, these naturally go down over time, and so the immune system becomes less and less competent, and you become more and more immune compromised. And again, that's important at any age, but it happens naturally as we age. So when you look at things that say vitamin C treats COVID, or zinc treats COVID, or helps you be less susceptible to infection, that's because these are key nutrients, key micronutrients the immune system needs, and again, naturally diminish in the system over time, making older people more susceptible, but certainly young people too. there's actually studies. So like there's a study right here about how lower E, just as an example, they looked at lower E and what it means to fighting viruses. And with lower E and fighting viruses, and again, I look at it more as A, C, and E, all your antioxidants, but this particular study showed you couldn't fight the HIV virus nearly as well if E levels were down. People that they gave a high level of E to, those people are able to fight HIV much better. This next one's really a big one. This is about CD4 and CD8 counts. If you're a chiropractor, you first heard about CD4 from a chiropractic study on AIDS patients showing that CD4 counts went up over 50% in the group being adjusted over time versus the group not being adjusted, who were getting a sham adjustment. So it was a blind study that showed the power of your nervous system getting healthier and what it meant to CD4 counts climbing. The other count is your CD8 count, also important in fighting viruses, particularly the COVID virus. So we have to be doing things, again, this is our science, this is the science of wellness. We've got to be taking care of ourselves, becoming more immune competent. So we are doing things like creating CD4 and CD8 levels at a high enough count to fight the virus. So in older people, once again, they found their A, C, and E, these antioxidants diminished in the system, along with other key micronutrients. CD4, CD8 counts went down. This has a lot to do with how your thymus would fight the infection. And so again, you become more susceptible to unfortunately dying if you're older and you've naturally let this occur. So as younger people or older people, we've got to make sure we're keeping those counts up. Inflammation. So many people, you may have been learning from out there, talking about what is this really? Is this really a virus thing, or is it something else? And what they're sharing with us is that really it's something else. If the body has an inability to manage its inflammation going into this thing, then you can get very sick or even die. So the studies are showing us that if we have managed to keep inflammation under control prior to getting infected, that infection will not be that big a deal. It means your immune system's working like it should. Some people's immune systems overreact. So we see a lot of autoimmune conditions. So they've got too much inflammation. The inflammation stays high throughout the infection of COVID until the people die. So monitoring IL-6 and IL-1 beta, these are the two inflammatory markers. The studies that have shown, like the one published in Lancet, on who survives and who doesn't survive from COVID, those revealed that the people who had high inflammatory markers at the beginning, those inflammatory markers stayed high, and then the IL-1 beta ended up in the lungs. These are the people that struggled and also who were not the survivors. So when it comes to IL-1 beta and IL-6, these are the key anti-inflammatory markers or pro-inflammatory markers that you got to be paying attention to. And again, if they stay high and pro-inflammatory, this is where it becomes a problem. It's that IL-1 beta concentration going into the lungs that causes the lungs to get the fibrotic damage, and again, for some people, unfortunately, to die from this. So testing IL-1 beta, testing interleukin-6, I've been saying this for a few weeks now. It's a big thing for all of us, especially older people, to test to see if it's under control prior to being infected. The next thing is just knowing your cells. So there's cellular immunity. So we've learned already that the reason older people would die is going to be a decrease in antioxidants and a lot of key micronutrients in their bodies naturally. Again, something that many people walk around deficient in today. But mitochondria, it's very similar in that it's the actual mitochondria in the cell that is the platform for innate immunity and this inflammatory response we've been talking about. So those mitochondria need to be super healthy, and those mitochondria, they are fed by clinical doses of B vitamins, lipoic acid, CoQ10, carnitine. When we do organic acid testing, we look specifically at those mitochondria life cycles. We need these key nutrients for them to function, and this innate immunity is critical. This is the wall that goes up that keeps actually the viruses out to keep you from getting sick in the first place. But innate immunity is also there to stop these viruses from spreading throughout the body, which again is what happens in COVID-19. It ends up in the lungs, and we can die from it. Here's another study on vitamin D that just came out. So vitamin D is another key nutrient, really critical to fighting viruses in particular. And they actually found in this study that people with higher vitamin D levels are less likely to become infected and less likely to die. A brand new study that just got published here recently. So another key reason, again, why somebody older or really, again, anybody would be more susceptible and possibly pass away. It's these nutrient levels that are depleted in most people already and just tend to become more and more and more depleted over time and creating this lack of competency in the immune system. So IFM, Institute of Functional Medicine, actually just came out with a number of studies. 23 studies are I've cited relative to different nutrients. Curcumin, you've got your EGCG, which is your green tea, NAC, resveratrol, vitamin D. Melatonin has had a lot of data come out on melatonin and managing inflammation in order to fight this virus. Vitamin A, PEA, vitamin C, zinc, quercetin, all discovered, lots of different studies to show that it's very effective, all these nutrients, in fighting against a virus. And so we know that these things command a lot of the attention when it comes to all you read out there with the different vitamin formulas for immunity, but we know also scientifically that our immune cycles, our immune system, the ability to create antibodies, a lot of these things are nutrient mediated, and so we need these nutrients at adequate doses in our formulas and at high levels in our body if we are going to have our best chance to fight against any infection at any time, particularly right now. Now, for me, with my patients, for my family, I just want to go out into the community and not have any fear. You know, I had a patient ask me recently, do I need to wear a mask? And I'm like, well, let me ask you a question. What do you think? She goes, well, I get adjusted regularly. I see every week. I'm taking your vitamin D. We tested my inflammation, and we've now got it under control. So I don't think I need to wear a mask. I feel confident in my immune system. I believe I'll be safe out there. I'm like, that's a great answer. That's what I would have said. And so, you know, we're empowering people to go back to life because they have confidence in their immune system because they know the science of wellness and building strong immunity. And, you know, and they're equipped. The next thing we need to be looking at is when it comes to inflammation, we've always talked about this, is anti-inflammatory eating. So we actually do food sensitivity testing because one of the great ways to have lots of inflammation out of control, again, inflammation out of control is the non-survivors who get infected with COVID-19, is if you're eating foods that your body's creating antibodies against, that your body looks at some of the foods you're eating as antigens, and it's creating a burden on your immune system, which you don't want. You don't want to burden the immune system right now, and it's creating a chronic level of inflammation that is out of control. So many people who even think they're eating healthy, when we run their food sensitivity test, will find things like avocado or almonds or dairy or chicken, something that they've thought, hey, this is supposed to be healthy for me. It turns out it may be considered a healthy food, but not for you. So we want low glycemic, anti-inflammatory type eating, which means you're low on sugars, it's good fats, it's reducing omega-6s, increasing omega-3s. It's that type of eating that helps us to manage inflammation. And once again, COVID-19, the danger is less that there's some virus that our body can't handle, but as many wellness scientists are sharing, it's the body's inability to manage inflammation, and diet could certainly put you in a bad position for managing inflammation. Then there's chiropractic. You know, we're going to shift gears now and get into antibody testing. I know that's what has gotten so popular now. We have already had over 600 doctors order 600 orders for antibody tests from our doctors, and we've got, we're behind. We're just ordering these things, and we've already tested dozens of people. It's big right now. It's important, and we'll get into it in a second. But chiropractic is a big part of generating antibodies. This is a study in the Journal of Chiropractic and Osteopathy. I didn't know there was such a journal, but this is where it was published. And when you adjusted somebody, actually their interleukin-2 counts went up, and an increased interleukin-2 regulation of antibody production, which is what we're looking for with this virus, that the inflammation system kicks in as part of the actual immune arc. So inflammation goes up. We actually then begin to produce antibodies so that we first get that IgM antibody. We then get the IgG antibody, and we're beginning to create immunity against this virus on some level. So chiropractic has been proven to help that with, guess what? Just one adjustment. That's how powerful just even one chiropractic adjustment is. It's protecting somebody from this virus, and it's helping them create antibodies moving ahead. So certainly all that we're talking about in terms of micronutrients that are needed, dietary changes that are needed, raising vitamin D levels, testing IL-6 and IL-1 beta, testing vitamin D, all that's really critical to maximizing immune competency. But with a chiropractic adjustment, again, I really believe you're as safe as you could possibly be. You can go around out there confidently that it's not the mask. I've built a titanium immune system. I am a tank. I'm an immune tank. That's what we want to feel like. So now let's get into just the testing. So, again, we already know this month in May, make sure you're testing IL-6, IL-1 beta, and vitamin D. Critical for people to test that and know and take action if there are problems. Also, we highly recommend testing for organic acids because that's how we can examine the cell, the mitochondria, and its function to make sure that innate immunity is working at an all-time high. So now with antibody testing, what you may not, some people don't understand it. People get confused between testing for the infection versus the antibodies. So I want to jump into that first. So realize the governments of the world, America, academic laboratories, everybody's jumping in, trying to identify which people have been exposed to COVID and have now produced antibodies. If you've seen recently, there was that study done, or they just did lab testing on a bunch of people in prison and found that almost all of them had been infected, but the vast majority never had a symptom. So the only way to know you were infected and symptom-free is to now see that you have antibodies. You would not have created especially your IgG memory antibody wouldn't be there if you hadn't been infected at some point. And this can assist people in knowing that they're free of this condition, they're going to have some level of immunity, and they're not at risk of actually infecting others and helping our country and our world get back to normal. So when you look at the two types of tests, again, not to confuse, one is the test, the nucleic acid test, the PRC for shoving the thing up your sinuses, getting a little brain tissue in there, and seeing if you're currently infected with COVID. The problem with that test, of course, is that there's no symptoms for 3 days, so you could be out spreading COVID around for 3 days without knowing it. You may never have a symptom, so you'd never be somebody who they would ever test. And also, within about 1 to 2 weeks, it moves out of your sinuses into the system, and so the test would be a false negative. You would look like you don't have it, but you do, and you could still be infectious to other people. So that's really where that antibody test is so powerful. In fact, recently, we tested somebody for antibodies and found they only had the IgM, which is the acute antibody. And so it turns out that they were in the middle of an infection and did not know it. So the antibodies to detect, and there's this arc of immunity. So it detects over the course of this arc where you are in the process of having, whether you were infected, are infected, or now moving on to having strong antibodies to give yourself, and I keep saying some level of immunity. It certainly hasn't been studied yet by any means to know just what the extent of the immunity is. Could you really go around kissing people with corona and not get it because you have antibodies? Nobody knows. Is it for 2 weeks, 2 months, for the rest of your life? We don't know. So that's why we're looking at these antibodies right now. So essentially, when it comes to the infection, the symptoms tend to wane over about a 10-day to 2-week period of time. Some people have shed this virus in as little as 8 days. That's how competent those immune systems are. That's back to being an immune tank. And right off the bat, you start to get this rise in your acute IgM antibody, and we can test for that. And as time goes on a little bit longer, as we get deeper into it, like 2-3 weeks into it, we now make IgG memory antibodies, and that's what we will carry on for a period of time to be, again, less likely to get this condition in the future, maybe not able to get it at all, and safer to go out into society. That's what we're looking at with these antibody tests. There's two types of tests, another point of confusion. One is a venous blood draw. So one, we're actually drawing blood, sending it into a lab, and that there's good specificity there. So you've got specificity somewhere between 95.6 to 97.5%. It's 100% sensitive to it being the actual antibodies that we're looking for, these COVID-19 IgGs and IgMs. So it's a good test, but actually there's similar sensitivity and similar accuracy with also a finger prick test. So blood draw, that's kind of the confirming test. That's always considered the gold standard. But for labs that may be overrun, chiropractors that certainly maybe aren't doing any sort of phlebotomy or don't have labs they're working with and don't want to run into that issue, the other option is that you would actually do what's called a rapid cassette. And these rapid cassettes, they happen right in the office. It's almost kind of like a pregnancy test where you drop the blood on it. There's a solution that goes on top of the blood. And within just a few minutes, you get a result right there in front of you. So this, I have kind of like a picture of what it looks like here. So you have this test that if it's got one line at the top, one red line, that means that the person doesn't have the antibodies. Underneath it, it has a G for IgG, and then there's an M for IgM. And within a few minutes, you'll know, do I have the IgG, the IgM, or both antibodies? And it's done right there in the office. You do it right there in the clinic. Really easy to do, and it's less expensive and less challenging, but it's got similar sensitivity, or even better in some circumstances than the blood draw, and it's got specificity of 100%. Both specificity means, once again, it's specific to the COVID-19 antibody and not other antibodies that we have floating around in our bodies. So we now have, again, hundreds and hundreds of these tests circulating around and being done in different clinics. A lot of people wonder, are these approved by the FDA? Both, you'll see, when you get them, they have the FDA information in there that makes them legal to provide in your office. These aren't from China. The ones we use aren't from China. We don't necessarily know or trust the equipment coming in from there. And we also know that this has gone through its validity testing. Another good question that you may have heard, these could be invalid tests, and they can be. They could be as little as 20 to 40% sensitive and specific, but this one's been validated and been approved. And so this one actually has really good sensitivity and specificity. So this is one that we know between where it comes from and based on its validity test that we can actually trust. There's actually a compliance document that comes with it, or a statement saying that this device has been approved by the FDA. So anybody that's concerned about that, just you're in good standing. For our doctors out there, we want to make this knowledge widespread. We want to get this word out there. If you're on the webinar right now, I'm also teaching Facebook Live. We're trying to get this everywhere we possibly can. So we're helping our doctors out. We're doing things like bundling the immune testing, so that's the IL-6, IL-1 beta, the vitamin D, with the rapid cassettes or with the actual venous blood draw kits so that you can get them out there in mass and start testing, as well as helping you understand what are the recommendations. So great, you've got the antibodies. You obviously had the condition already. Maybe you didn't have symptoms. Maybe you struggled for a while. Maybe you struggled a lot, but now you're past it. You're a survivor. But now what are we really teaching our patients, people in our community? What are we really supposed to be doing? And that's teaching them about immunity. Like we started, immune competence. Our science are the studies that show why somebody does die as they get older from COVID-19. Because we've got to make sure those nutrient levels are as high as they need to be, manage inflammation, get them adjusted, keep those vitamin D levels 60 to 100. There are things we can manage. We can manage the mitochondria by, again, we could test it or at least make sure we're taking the nutrients necessary to keep our mitochondria functioning. It's the foundation of our innate immunity, managing inflammation. It's the wall that goes up that keeps the virus out and keeps it from disseminating, spreading once it's inside of us. Again, this is the science we're teaching. So testing is a real critical part of this, but then also teaching why you need to be a patient in our chiropractic clinic and the nutrients you need, not just now during this crisis, but at all times, since the immune system is always one of the two super systems between your nervous system and the immune system that is keeping you alive, helping you to thrive in any environment you walk into, COVID season, flu season, or not. We have to remember, in 6 months, literally from the day I'm shooting this, May 1st, in 6 months they're saying it's going to be back. whether it's really back or they're just calling it COVID season, calling it flu season, we need to be getting our patients prepared. Our programs are actually a 6-month program, put them on a 6-month protocol. So right now it's not just to survive today, but it's also to get ready for the next onslaught so you can be that immune tank, you can be immune competent, you can be immune confident, walking around your community, staying at work, serving God and saving lives here, not just now, but again in another 6 months. So we've got packages for the testing, so that you can bundle D and IL-6, IL-1 beta tests together to get lots of people tested. We have bundles of the necessary foundational nutrients. We've gone through a lot of different nutrients here. We actually have created products that have all those nutrients in them that diminish over time or are flat in your bodies today. It's your great multivitamin with clinical doses of the necessary ingredients, the vitamin D, and the omega-3, which is one great way we fight inflammation, make sure it's being managed properly, since most people have a 30-to-1 omega-6 to 50-to-1 omega-6 to 3 ratio, and so they walk around in inflammation. So, we have our protocols, our diets, and of course our chiropractic bundled together. During this whole thing, we've had a lot of doctors that we've helped do campaigns, and we've now talked to hundreds of people virtually, where people were not coming to clinics or couldn't get to clinics or clinics were shut down. We began seeing hundreds of patients through telehealth, through a telehealth platform, who have been utilizing these bundles, selling the testing, auto shipping the test to the patient who could take them at home and then send it into the lab, and the doctor then gets the report, meets with the patient on telehealth a week later, and offers them their protocol, what they'll do for 6 months with diet, with nutrition, and ultimately, hopefully they can get into our clinics or some other clinic for chiropractic. So we've been doing that with hundreds of people, again, virtually. That may have to happen in November too. You want to have ramped up your virtual platform. Make sure you have telehealth up and firing away right now, because you may need it again really strongly in November. Then for other offices, it's really become like a business within the business. They'll continue to do a large telehealth business, help a lot of people around the country or even around the world, in addition to what they're doing locally. Personally, I practice part-time. I see about 70 patients a week in about an hour and a half. But then I do a lot of telehealth for my own patients and people, Colorado, Washington, D.C., New York, New Jersey, all over the country, a couple hours away from me. It's a way that I will continue to see patients and continue to thrive and virus-proof the clinic. I call it virus-proofing. Whether you can come in or not, we can still help you. So, making sure people get on those base nutrients. They're multi, they're D, they're E+. Then once the tests come back, then we'll actually make some modifications. We may need a lot more D than they're taking. I saw somebody's D the other day. It was an 8. It's supposed to be 60 to 100, and they were taking a vitamin D product. Now, it was an inferior product, but it was still taking vitamin D, and it was still an 8. Turns out they have to take about 4 times more than they were taking, as well as take a quality product that actually can be absorbed and utilized in the system. So, this is offices, dozens of people already doing this. For, patients, just making sure that they understand that, what those things could possibly be as far as their costs. Just like for like a 6-month protocol, that may be $700 to $900 for a patient to do this over 6 months. So really, truly inexpensive over the 6 months to be tested twice and take their supplements. And then there's also just, if they wanted to just get tested, what that would look like. There's a bundle for that. There's a bundle with the testing and the supplements. So you've got lots of options to get people started. And like, for example, a doctor yesterday did a text campaign, got 11 people on the line. All 11 of them bought a bundle of the 3 basic supplements they need to survive any virus season, as well as the 3 tests. And now some of them coming in also for antibody testing this week. So I think the antibody testing, again, is something a lot of you got in line to do. It's a big way we help lead the country forward. But then don't miss out on the opportunity to teach them about immune competence, what chiropractic has to do with it, as well as the lifestyle will help them actually follow. If you're looking for help from us, if you want to get involved in programs like this, you can go to services@vitaleohealth.com. services at VitallioHealth.com. Myself, my partner John McGuire, our whole team is there ready to help you, help the people in your practice, your communities, and together the goal is to bring the world back to normal, to save it, to rebuild the wall, and help society thrive again.